Welcome to the Deep Dive. Today we're tackling a topic many of you asked about, keratoconjunctivitis sicca,
Right.
or maybe better known as canine dry eye.
Exactly. It's a really common one.
So we'll dig into what it is, why it happens, and importantly, what can be done based on the expert info you shared with us.
Yeah, we look through the sources, and the core issue really is a problem with the tear film in the eye.
Tear film. Okay.
Specifically, it's a lack of the watery part, the aqueous layer, as one source puts it.
Right, the watery bit. So if there's not enough of that, what's the knock-on effect?
Well, when that watery layer is low, the surface of the eye just starts to dry out.
The surface being the clear part.
Yeah, the cornea, that clear front window, and also the conjunctiva, the pink tissue lining the eyelids and covering the white part.
Okay.
And that dryness, that leads directly to inflammation, which is where all the trouble starts, really.
Inflammation, got it. So who gets this? Is it like any dog?
Well, it's common in dogs, generally.
Mm-hmm.
Quite common. But interestingly, it's pretty rare in cats.
Oh, okay.
Hmm.
Good to know for multi-pet households.
Definitely. And even within dogs, certain breeds are much more likely to get it.
The breed predispositions. Which ones are we talking about?
Your sources list quite a few. Lots of the brachycephalic breeds, the ones with the shorter, flatter faces.
Like pugs, bulldogs.
Exactly, them. But also spaniels, miniature schnauzers, poodles, bloodhounds, even Samoyeds, Westies, Yorkies. It's a fairly long list.
Wow, yeah. Does that facial structure play a role?
It can, yeah. Sometimes their anatomy affects tear drainage or eyelid function, which can sort of contribute.
Okay. So if you have one of those breeds, is it guaranteed? And what about genetics? Does it run in families?
Not guaranteed, no, but definitely something to be more aware of if you have one of those breeds.
Right.
As for inheritance, well, the exact way it's passed down isn't fully mapped out yet.
Hmm.
We know breeds matter, so genetics are clearly involved, but the specifics still being researched. And the age it starts can vary a lot, too, depending on what's actually causing it in that particular dog.
Okay. So for all of us listening, what are the signs? What should we be looking out for? The red flags.
Okay, key things. Redness is a big one.
Yeah.
That conjunctiva, the pink part, just looks more red, more irritated.
Conjunctival hyperemia, is that the term?
That's the one, yeah. And then discharge, often quite noticeable.
What kind of discharge?
It's usually described as mucoid to mucopurulent. So thick, maybe cloudy, sometimes yellowish green, kind of gunky looking.
Gunky discharge. Okay. Intermittent or constant?
Can be either. Really depends on how bad it is. Could come and go or just be there all the time.
Right. What else?
You might notice your dog squinting a lot or blinking excessively, like their eyes are bothering them.
Blepharospasm.
That's it. And as things get worse, you can actually see changes on the cornea, the clear part.
Oh, dear. Like what?
Well, obvious dryness, of course, but also you might see tiny blood vessels starting to grow across it.
Trying to heal itself.
Kind of, yeah. It's called vascularization, the eyes reacting to the chronic irritation. You might also see pigment, like dark spots appearing on the clear surface. And scarring, too. Fibrosis. The cornea gets thickened, cloudy in areas. And in more serious situations, you can get corneal ulcers, actual sores on the surface.
Ulcers sound really painful.
They absolutely are. Very uncomfortable. And all that discharge can make the eyelids themselves inflamed. That's blepharitis.
So it affects the surrounding area, too?
It can, yeah. And the worst case scenario, if it's severe and goes untreated, is impaired vision or even blindness.
Wow. Okay.
And just a reminder for cat owners, the sources say cats tend to show fewer obvious signs than dogs. So it can be trickier to spot.
Good point. So we know what it looks like, who's at risk.
Yeah.
But what actually causes it? Why do the tears dry up? Sounds like it could be a few things.
You're right. There are several potential causes. The most common one seems to be immune-mediated.
Immune-mediated, meaning the body's own immune system.
Exactly. It sort of mistakenly attacks the glands that produce tears. Sometimes it's called idiopathic, too, meaning we don't know the exact trigger for that immune reaction.
Huh. Any link to other immune issues?
Yeah, possibly. It might be connected to things like general allergies or atopia in the dog. Research is ongoing there.
Okay, so the body attacking itself is the main one. What else?
Infections can be involved. Canine distemper virus is one. In cats, chronic inflammation, maybe from herpes virus, can do it.
Okay.
Then there are what we call iatrogenic causes, meaning caused by medical treatment.
Like a side effect.
Sort of. A big example is removing the third eyelid gland, sometimes called cherry eye surgery. That gland makes a lot of tears, so removing it is risky, especially in those breeds already prone to dry eye.
Right, you wouldn't want to reduce tear production further.
Precisely. Also, radiation therapy near the eye can damage the glands.
Makes sense. Any other triggers?
Yes, quite a few more. Congenital KCS born with it that's seen more often in Yorkies.
Ah, Yorkshire Terriers again.
Yep.
Neurologic problems, too. If the nerve supply to the tear gland is damaged,
How would that happen?
could be issues with the trigeminal nerve or a condition called dysautonomia.
Yeah.
And an interesting clue the source mentions is if it's neurologic, the dog might also have a dry nose on the same side.
Oh, interesting connection.
Yeah. Trauma can do it too, like if the eye pops out, proptosis, or even just inflammation in the eye socket area.
So physical injury.
Can definitely be a trigger.
Mm-hmm.
And then there are systemic diseases, things affecting the whole body,
Like what?
diabetes, Cushing's disease, hypothyroidism, or just being generally unwell or debilitated can reduce tear production.
So overall health plays a role.
It seems so. And finally, certain drugs,
Hmm.
some antibiotics, specifically sulfa drugs like trimethoprim sulfadizine.
Really? Antibiotics?
Yeah, that specific type.
Okay.
And also an NSAID, a pain reliever called etodolac. These have been linked to causing KCS in some dogs.
Good to know. Oh, and one last one, temporary or transient KCS. That can happen sometimes with general anesthesia or using atropine during surgery. Usually resolves afterwards, though.
Okay, wow. That is a complex list of potential causes.
Ah?
So how does a vet figure out? It's definitely KCS, especially with those other eye issues it might look like.
That's a really important point. The sources stress that it's easily confused with simpler things like allergic conjunctivitis or a basic bacterial infection.
Right, because they can also cause redness and discharge.
Exactly. And to make it trickier, dogs with KCS often get secondary bacterial infections because the lack of tears messes up the eye's natural defenses.
Ah, so it could be KCS plus an infection, a double whammy.
Could be, yeah. So telling them apart is key.
How do they do that?
The #1 diagnostic tool is the Schirmer tear test.
The paper strip test.
That's the one. Very simple, very effective. A special sterile paper strip is just gently tucked inside the lower eyelid for 1 minute.
And it measures what?
How much watery tear is produced in that minute? It measures the wetting on the strip in millimeters.
Okay, what's normal versus what indicates KCS?
Generally, in dogs, normal is 15 millimeters or more wetting per minute. Dogs with clinical signs of KCS usually measure less than 10 millimeters per minute, often quite a bit less.
Clear difference then, usually.
Usually, yes. The source does mention interpretation can be a bit trickier in cats sometimes.
Right. So Schirmer test is the main thing. Any other tests they might run?
Definitely. Fluorescein stain is very common. That's the orange dye test.
To check for ulcers?
Exactly. You put a drop of dye in, rinse it, and if there's an ulcer, the dye sticks to that spot and glows under a special blue light. Crucial check, given the risk with KCS.
Makes sense. Anything else?
They might do conjunctival cytology. That means gently collecting some cells from the eye surface with a swab or spatula and looking at them under a microscope.
What does that show?
It can help see what kind of cells are there, if there's excessive bacteria, what type, maybe signs of inflammation. Gives a better picture of what's happening on the surface. And if the initial treatment isn't working well, or if there seems to be a really nasty infection, they might do a bacterial culture and sensitivity.
To pinpoint the exact bacteria and best antibiotic.
Precisely. Grow the bacteria in the lab and test different antibiotics against it.
Got it. So once you have the diagnosis, KCS confirmed, what's the plan? Is it curable?
Generally no. It's usually about management, not cure. Your sources really emphasize that medical therapy is typically lifelong.
Lifelong. That's a big commitment for owners.
It is. Unless there's a really severe corneal ulcer needing hospital care, treatment is normally done at home by the owner. It's outpatient care.
Okay. And the sources mentioned something about applying different types of eye meds,
Yeah.
like drops versus ointments.
Yes, good point. If a dog is prescribed both like a watery solution and a thicker ointment, there's a specific order.
Which is?
Solutions first. Always put the watery drops in first, then wait at least 5 minutes.
The minutes, okay. Why the wait?
To let the solution get absorbed properly and start working before you put the thicker ointment in, which could kind of block it or wash it out too quickly.
That makes sense. Ointment lasts.
Ointment lasts at least 5 minutes after the solution.
Good practical tip.
Yeah.
Now, what if, despite treatment, the eye seems more painful?
That's an important warning sign. The sources say if eye pain suddenly gets worse, contact your vet immediately.
Because it could mean.
It could signal a developing or worsening corneal ulcer, which needs urgent attention and probably different medication.
Right, don't wait on that. Is there ever a surgical option?
There is, yes. For very severe cases that don't respond well to medication, especially maybe some congenital cases, there's a procedure called parotid duct transposition.
Parotid duct transposition. Sounds complex.
It is quite involved, yeah. It involves surgically rerouting one of the salivary gland ducts, the parotid gland duct, which normally puts saliva into the mouth so that it empties saliva onto the eye surface instead.
So using saliva as a tear substitute.
Essentially, yes, to provide moisture. But there are downsides.
Oh, like what?
Saliva isn't the same as tears. It can sometimes irritate the cornea, and it can cause mineral deposits to build up on the eye over time.
Mineral deposits. Huh.
Yeah. And even after the surgery, some dogs still need topical medications as well. So it's not always a perfect fix, more of a salvage procedure for tough cases.
Okay, so medication is really the mainstay. Let's talk about those. What types are used?
Right, several categories. First, you have lacrimostimulants. Their job is to try and stimulate the dog's own tear glands to produce more natural tears.
Boosting tear production. What drugs are those?
The main ones are cyclosporine and tacrolimus.
Heard of those?
Yeah, they're common. Cyclosporine usually comes as a 0.2% ointment, or it can be compounded into a stronger 1 or 2% solution. Tacrolimus is often a 0.02 or 0.03% solution or ointment.
How often are they used?
Typically every 12 hours, so twice a day.
Mm.
But for really severe KCS, the vet might say every 8 hours, 3 times a day.
Okay. Any others in that category?
For KCS caused specifically by nerve problems, topical pilocarpine might be tried, usually 0.2% every 8 hours. Oral pilocarpine is sometimes considered, but the sources warn it has a very narrow safety margin, easy to overdose, so it needs extremely careful dosing and monitoring.
Very tricky then.
Very. And for cats with KCS, antivirals are often the main treatment, targeting underlying issues like herpes.
Got it. So those try to increase tears. What if that's not enough? Or while waiting for them to work?
That's where lacrimomatics come in, artificial tears.
Just lubricating eye drops.
Exactly. They help lubricate, make the eye feel more comfortable, reduce the dryness symptoms. Lots of different types, watery drops, thicker gels, ointments.
How often do you use those?
Depends on the severity and the product. Could be as often as every couple of hours for a watery drop in a very dry eye, or maybe just twice a day for a thicker gel or ointment. Ointments are often good for overnight use.
Right, longer lasting.
Yeah, and as the cyclosporine or tacrolimus starts working over weeks or months and natural tear production improves, you can usually reduce how often you need the artificial tears.
Okay, that makes sense.
Yeah.
You supplement until the natural system kicks in more. What about those secondary infections?
Right. For those, topical broad-spectrum antibiotic ointments are usually prescribed.
For how long?
Typically for about 3 to 4 weeks, applied maybe every 6 to 8 hours, depending on the vet's instructions.
And cleaning the eye first is important.
Crucial. You need to gently clean away all that discharge before putting any medication in, otherwise the meds can't reach the eye surface properly.
Just with water.
Usually a sterile eye wash solution is best. And if the mucus is really thick and stubborn, the source mentions using 5% acetylcysteine solution first.
What does that do?
It's a mucinylitic. It helps break down and liquefy thick mucus, making it easier to rinse away before you put the other meds in. Maybe used every 6 to 12 hours before cleaning and medicating.
Useful tip for those really gunky eyes.
Oh.
What about inflammation itself? You mentioned corticosteroids.
Yes, topical corticosteroids, steroid eye drops, or ointments can help reduce the inflammation, the blood vessel growth, and that pigmentation on the cornea.
But didn't you say they can be risky?
They can be. Their use is generally limited until tear production has improved significantly. The main concern is that steroids can increase the risk of corneal ulcers or make existing ones worse.
So definitely only use if prescribed, and probably not if there's an ulcer present.
Exactly. They need careful veterinary supervision. Avoid it if ulcers are present or if the KCS is really severe with very low tear production because the risk of ulceration is just too high.
Okay. Any other side effects or issues with the main meds like cyclosporine or tacrolimus?
They are generally very well tolerated. Occasionally, maybe some mild irritation when first started, but rarely a major issue.
And the pilocarpine.
That one can cause irritation when applied topically. And as we said, the oral form has that risk of systemic side effects, things like drooling, vomiting, diarrhea, heart rate changes, hence the need for extreme caution.
Right. So it sounds like ongoing vet checks are absolutely essential.
Absolutely. Regular rechecks are key to monitor how the treatment is working. Check the tear production levels, look for any complications like ulcers, and adjust the treatment plan as needed.
How often are those checks usually?
Typically, the Schirmer tear test is repeated maybe 4 to 6 weeks after starting cyclosporine or tacrolimus to see how much improvement there's been.
And should you give the medication before that recheck appointment?
Yes, definitely. Give the tear stimulant medication as usual on the day of the appointment. The vet wants to see how well it's working while the drug is active in the system.
Good to know. So overall, what's the outlook?
The prognosis is generally pretty good for maintaining comfort and vision if treatment is consistent and lifelong, but owner commitment is huge. Some cases are definitely more challenging and might need more adjustments, combination therapies, or even considering that surgery we talked about.
Okay, so let's try and wrap this up. Key takeaways.
Yeah.
Canine dry eye, KCS, it's common, especially in certain breeds,
Right. Fundamentally, a lack of watery tears.
leading to dryness, inflammation, discomfort. Signs like redness, gunky discharge, squinting are important to spot.
And that Schirmer tear test is the main way to diagnose it.
And crucially, treatment is usually lifelong management, often with meds like cyclosporine or tacrolimus plus artificial tears.
That's the core of it, yeah. Lifelong commitment.
So the big message for listeners, if you see those signs in your dog,
Get them checked out by your vet promptly. Don't wait. Early diagnosis and starting treatment can make a massive difference.
prevent complications like those nasty ulcers and protect vision.
Exactly. It improves their comfort, their quality of life, and their long-term eye health significantly. Being proactive really pays off here.
Definitely. And it makes you think, doesn't it? With all those diverse causes, genetics, immune system infections, other diseases, even medications,
Yeah.
it really highlights how interconnected everything in the body is. What other conditions might have these kinds of surprising links that we maybe don't always consider?
That's a great point. It emphasizes why looking at the whole picture, that sort of holistic view of health, is just so important for our pets.
A fascinating thought to end on. Thanks for walking us through all that detail today.